Hello friends, welcome to my channel, The Nurses Station. Situations like this happen in healthcare, and they are part of what we call ethical and legal issues in nursing. In today's video we will understand what ethics and morals are, the important ethical principles in healthcare, what an ethical dilemma means, how nursing practice is regulated, and the concept of legal liability. So make sure you watch this video till the end, because by the end of this presentation, you will clearly understand how ethical and legal responsibilities guide nurses in making safe and professional decisions in patient care. Now let us understand morals. It is the behavior in accordance with customs or tradition, usually reflecting personal or religious beliefs, whereas ethics is the branch of philosophy concerned with the distinction between right and wrong on the basis of a body of knowledge, not only on the basis of opinions. For example, a nurse may personally believe something based on moral values. However, professionally, the nurse must follow ethical guidelines and respect the patient's decisions. Therefore, nurses must learn to separate personal morals from professional responsibilities. Let's now discuss about ethical principles. 1. Principle is autonomy. Respect for an individual's right to self-determination and making one's own decisions. For example, patients have the right to accept or refuse treatment after receiving proper information. 2. Non-maleficence. The obligation to do or cause no harm to another. In providing care, the nurse is obliged to refrain from acts that unnecessarily cause injury, harm, or suffering. 3. Beneficence. The duty to do good to others and to maintain a balance between benefits and harms. Paternalism is an undesirable outcome of beneficence, in which the healthcare provider decides what is best for the client and encourages the client to act against their own choices. 4. Justice. The equitable distribution of potential benefits and tasks determining the order in which clients should be cared for. 5. Veracity. The obligation to tell the truth and communicate truthfully. 6. Fidelity. The duty to do what one has promised, to maintain loyalty and commitment to the client, to be faithful to agreements and responsibilities one has undertaken, and to do no wrong to the client. As you now understand about ethical principles, let us discuss about ethical dilemma. An ethical dilemma occurs when there is a conflict between two or more ethical principles. No correct decision exists, and the nurse must make a choice between two alternatives that are equally unsatisfactory. Such dilemmas may occur as a result of differences in cultural or religious beliefs. For example, a patient refuses a life-saving treatment due to personal beliefs. The nurse wants to save the patient's life but must also respect the patient's autonomy. This creates a conflict between beneficence, doing good, autonomy, respecting patient choice.
Here is a quick recall of topic ethical principles in nursing and ethical dilemma. 1. Autonomy, meaning respecting the patient's right to make their own decisions. Example, a patient refuses surgery and the nurse respects the patient's decision. 2. Beneficence, meaning doing good and acting in the best interest of the patient. Example, providing comfort care and pain relief to improve a patient's well-being. 3. Non-maleficence, meaning do no harm. Avoid causing harm to the patient. Example, double-checking medication dosage before administering it. 4. Justice, meaning treating all patients fairly and equally. Example, providing equal care to all patients regardless of their background or financial status. 5. Fidelity, meaning keeping promises and being loyal to the patient. Example, following through with care you promised a patient. 6. Veracity, meaning telling the truth and providing accurate information. Example, honestly explaining a diagnosis or procedure to a patient. Whereas ethical dilemma occurs when a nurse faces a situation where two or more ethical principles conflict, making it difficult to decide the right action. For example, a patient asks the nurse not to tell their family about a serious illness. Now the nurse hears conflict between the two ethical principles. Autonomy, to respect the patient's wishes. Veracity, the family expects truthful information. Here the nurse must decide the best ethical action while respecting professional standards. Here is a quick memory trick. AB-NJFV. Autonomy, beneficence, non-maleficence, justice, fidelity, veracity. Moving forward, our next topic is standards of care. 1. Standards of care are guidelines that identify what the client can expect to receive in terms of nursing care. 2. The guidelines determine whether nurses have performed duties in an appropriate manner. 3. If the nurse does not perform duties within accepted standards of care, the nurse may be in jeopardy of legal action. 4. If the nurse is named as a defendant in a malpractice lawsuit and proceedings show that the nurse followed neither the accepted standards of care outlined by the State or Province Nurse Practice Act nor the policies of the employing institution, the nurse's legal liability is clear. The nurse is liable. Note: the nurse must follow the guidelines identified in the Nurse Practice Act and agency policies and procedures when delivering client care. Next is hospital staffing. 1. Charges of abandonment may be made against nurses who walk out when staffing is inadequate. 2. Nurses in short staffing situations are obligated to make a report to the nursing administration. Floating. 1. Floating is an acceptable practice used by healthcare facilities to alleviate understaffing and overstaffing. 2. Legally, the nurse cannot refuse to float unless the institution has a union contract guaranteeing that nurses can work only in a specified area, or the nurse can prove lack of knowledge for the performance of assigned tasks. 3. Nurses in a floating situation must not assume responsibility beyond their level of experience or qualification. 4. Nurses who float should inform the supervisor of any lack of experience in caring for the type of clients on the new nursing unit. Kindly note floating is important topic according to examination point of view. Remember their points carefully. Again, a very important topic. Every nurse should know about their roles and responsibilities and the laws made breaking those could question the nurse liability. Now let's understand what is negligence and malpractice and what are few examples of negligence act. Topic: legal liability. A. Negligence. Negligence is conduct that falls below the standard of care. Negligence can include acts of commission and acts of omission. The nurse who does not meet appropriate standards of care may be held liable. Example of negligent act: 1. Failure to provide a safe environment for the client. 2. Failure to follow policy and procedures. 3. Failure to respond to or correctly implement new and existing orders. Medication errors that result in injury to the client. Failure to use aseptic technique when indicated. 4. Failure to provide adequate care that results in altered skin integrity and pressure injuries. 5. Failure to check equipment for proper functioning, etc. These are few examples. There are many more which held nurse liable. Next is malpractice. Malpractice is negligence on the part of the nurse. Malpractice is determined if the nurse owed a duty to the client and did not carry out the duty and the client was injured because the nurse failed to perform the duty. Example: administering the wrong medication dose that harms the patient. Next is proof of liability. It means showing that a healthcare professional is legally responsible for harm caused to a patient due to negligence or improper care. In nursing, liability is usually proven by 4 elements. 1. Duty of care. The nurse had a responsibility to care for the patient. 2. Breach of duty. The nurse failed to provide the expected standard of care. 3. Causation. The nurse's action or negligence directly caused harm to the patient. 4. Damages. The patient suffered injury, harm, or loss as a result. I hope you may know these topics. If you find this video useful, kindly like, share, subscribe my channel The Nurse Station or more useful video. Conclusion. In conclusion, ethical and legal principles play a vital role in nursing practice. Understanding the difference between ethics and morals helps nurses make responsible decisions while providing patient care. Ethical principles such as autonomy, beneficence, non-maleficence, justice, and fidelity guide nurses in delivering safe, respectful, and compassionate care. Sometimes nurses may face ethical dilemmas where the right decision is not always clear. In such situations, professional guidelines and ethical frameworks help nurses make appropriate choices. Thanks for your dedication. Please follow for more useful videos. Thank you. Like, comment is this video useful for you, share, and don't forget to subscribe.